I'm going to listen to his heart and lungs, make sure he's all healthy and all of that. So, he's going to growl at me. That's all right. So I'm listening to his heart. I'm listening to make sure it's got a normal rhythm, and no murmurs. Make sure it's the classic lub-dub sound. And with his lungs, I want to make sure there's no crackling or anything like that. So, and everything sounds normal, even with him growling.
Go.
Now I'm going to attach my ECG monitor to my sleeping patient. So I'm going to wet my areas that I plan to place with alcohol, which will be the left hind, the right hind, and the right front. So I'll go ahead and attach. So then,
she was like, did I miss something? I'm like, yeah, I got your bed. She's like, oh, that's so awesome. I'm totally
so I have my red lead attached to my left hind, my green attached to my right hind, and then my white, which is attached to my right front. And then I will turn this on and we'll be able to monitor on our computer. Alright, so I'm going to show you, I have my restraint pole here, or rabies pole. And obviously she's not an aggressive dog, but in the case she was, you'd have this, and then we can hold her away, so that we can safely administer drugs if we need, or get her into a kennel without, having to get too close to her. So in order to take it off, you just kind of loosen it, and she'll back her head out. Alright, I'm going to demonstrate how to catch urine on a male dog. This is Hiram, and I've got my ladle and cups to put the urine in when I'm done. I'm going to slide it underneath him midstream and catch the urine, and then pour it in the cups. So, let's see if he'll go for us. Come on, Hiram. Potty. Okay, so excuse the barking, I'm back in the boarding run, but this is the run I'm going to clean for the video. We had a puppy in here and he peed underneath his bed. So I'm going to go ahead and pull the bed out. Toy and then his bowl of water. I'll go ahead and set this stuff up here. And I will grab my spray. And we use Kennel Care, so we'll go ahead and pump it a few times. And then lock it into place. I'll pull my trigger, kind of spray it all over so that we can get it all disinfected. Especially at the spot where he peed. Alright, we'll let that sit about 10 minutes and then I will rinse. Okay, so now that's been sitting about 10 minutes, I'm going to go ahead and rinse the disinfectant away, and then I'll kind of dry it so that the puppy isn't exposed to any of the chemicals. We have a towel because he likes to play with his water. and bed and toy back in. Norman. Keep moving. Okay, he really wanted it back. So, that is how you clean out a kennel. Okay, I'm going to place a catheter in this male dog. So I'll clip around his prepuce first. Alright, so now I'm just going to clean around it just a little bit with some alcohol before I place my urinary catheter. So now I have my catheter. I cut some slits here so that I don't touch the red part, but I did put some sterile lube on the end. So now I will extend his penis. Place the catheter.
Hold on, let me check.
Without touching the catheter. Alright, so I'm placing my catheter without touching the red part. We'll extend it all the way in. And then if I was going to pull urine, I would just attach a syringe and pull back. I believe I am into the bladder by now. So then to remove, I'll just pull it out. Okay, so now we're going to get a cysto on Daisy here. She's been peeing in the house. Oh, Daisy. Oh, Daisy. It's okay. It's okay. Good girl, Daisy. Alright. Okay. So Dr. Beeman is going to use the ultrasound probe to find her bladder.
It's okay. Big bladder.
And then he's going to insert a needle into her bladder and pull some sterile urine out for a urine culture. A urine culture. And we got plenty. And now we'll run that and see if she's got an infection. Okay, so now I'm going to do his tear test. I have my test here. I'm going to go ahead and open his eye. Insert that down by the conjunctiva and hold his eye shut. And we will let it run for about 60 seconds. We're at about 30 seconds now, and he's right at about 15, so. Got about 5 seconds left. All right, it's been 60 seconds. and he is right at 18. Okay, so now I'm going to do his eye fluorescein test, make sure he doesn't have any scratches or anything like that. So I have my strip here. And I will get it open, maybe. And so typically when here, anyway, we've always kind of put it in a syringe, makes it a little bit easier to administer. So we take the tip of it off, and I take my eye wash and I put it in the syringe. And I'll put my plunger in. So then I have this all ready. I'm going to go ahead and administer a drop without touching it to his eye. He's going to cooperate, I don't know. I'll do this eye. Alright, so now that is in. Okay, and now I will run and grab my ophthalmoscope and look in and make sure he doesn't have any scratches. Okay, so now that I have my scope, I'm going to go ahead and turn it on, my light, and I'm going to look at his eye for any scratches or any places where stain uptake would be. And I do not see any, so I don't believe he has any scratches on his eye. So that, I will go ahead and rinse it now. And there we go.
Rolling.
Okay. So now I'm going to administer some proparacaine into his eye before we do the, get out the tonometer. Okay, so now I'm going to load the probe. And then there is my reading. Oh. Okay, so now we're going to do anal glands. This is Violet. So I've got my gloves on already, and Bria's going to gently restrain for me. So we'll have her stand up. Get her anal glands. They're at about 4 and 8. Maybe she'll share. There you go. Bye. Bye.
Stop.
So that was one side. Gently squeeze until okay. And there are anal glands. So now I'm going to mix up my enema and give it to this dog, but I'm not actually going to do the enema, but I will show placing the tube and everything. So I have my lube. Doesn't take very much. And then I have my container of warm water here, so I'll suck some of that up.
Oh my God.
Kind of mix it up in my syringe. And then I will attach my red rubber catheter. And I already lubed it before we went on screen. But then I'm going to have her stand up. And I'll lift her tail. And then I'll insert the catheter. And then if I was going to actually give this enema, I would go ahead and squirt all of this in. And then pull the catheter out and take her outside so she can go potty outside. And so to remove it, I'll go ahead and just pull the catheter out gently. And that is... Okay, so now I'm going to put topical medication on my cat here. I have Frontline Gold. So with this, you just kind of twist it down and push at the same time to break the seal. And then with cats, you know, typically with Frontline, you put it kind of between the shoulder blades. With cats, we tend to go a little bit higher just because they're flexible and we don't want them to get around and lick it off. So I'm going to go ahead and kind of put it between the base of his skull, actually probably closer to the base of his skull. So I will part the hair. He might fight me on it, just because he wants attention. Get it clear down to the skin, squeeze all of it on there, kind of put the hair back, and that is how you apply topical medication. Now I'm going to show you how to clean ears and then medicate them on a dog. So I have my Epiotic, or just any general ear cleanser will work. You lift up the flap and put a decent amount in, and then kind of massage it until you hear the kind of the squish. I'll do her other ear as well. Hang on. And I'll let her shake here in just a second. And then I'll take my 4x4 or a piece of paper towel. And I'll go in and I'll kind of wipe out the extra stuff. Her ears are not super dirty. Oh, you're all right. Get any extra moisture out. And then this is my ear medication. It's just Tresiderm, but I will show how to put it in. So same thing. We'll put the ear flap up and put a couple of drops and let that soak in. Do that in both ears. Okay, so now I'm going to clean and medicate this cat's ears. This is my cat Haas. He's a good boy. So, take my ear cleaner. Yeah, I know. He doesn't like his ears cleaned. I know. I'll kind of squish it around. Take my gauze or a piece of paper towel, and I will go in and remove any dirt that I can get. His ears are pretty dirty. I'll get a fresh one for the other side. And then to medicate him, I have some Tresiderm. So I'll just put a couple of drops in each ear. She's not exactly a big fan of either. And that's how you clean and medicate a cat's ears. Okay, so I'm going to give this cat some sub-Q fluids. So I've got my bag of fluids here. There's not a whole lot in it. It's just a partial bag. This is just for demonstration purposes anyway. And he is sedated. I have some other things to do, so we had his teeth cleaned this morning. So, all right. So I have my needle. I am using an 18 gauge needle for this, but I will come up by his shoulders and I will make a kind of a tent, and I'll poke into that tent so it's under the skin, and I will turn my fluids on and let it run, making sure that it's going into his skin and not leaking out somewhere else. We do this in cases of mild dehydration, and a lot of times with the drugs that I used with him, or just anesthetic procedures in general. If we don't do an IV catheter, we at least try to do some sub-Q fluids like this to help push the drugs and help flush their systems and all of that. So now that I'm done with fluids, I'll turn off my IV line here, and I will gently pinch where I had given it and pull the needle out. And I pinch just so that it hopefully doesn't leak, but happens. So now he's got a little blub here of fluid under his skin, and his body will over time absorb that moisture. So okay, this is Kendall, and she is going to help me demonstrate how to trim nails on a dog. So we have this type of trimmer, or we have the guillotine type. I prefer the blue handled ones. And then we have our quick stop in case I catch her. So, Kendall, can you sit? Good girl. I will get her paw. I'll pull the hair back and I'll expose her nails. And then I will trim just a little bit at the end, avoiding the quick. And I will do that on all of the nails. And that's how to trim a dog's nail. Hi, my name is Danielle Applegate, and I am going to show you how to trim a cat's nails. First of all, he has a thunder shirt on, so he doesn't move a whole lot, and kind of helps reduce his stress. So, I have here are two different styles of nail trimmers. I prefer the orange handled ones, but some people prefer the guillotine type. And then we have some quick stop just in case he bleeds. So, and then I will just push on his paw pad and expose his nail. And I'll just take the hook off so that I don't get the quick. And I'll do that on all of his paws. Oh, Gibby. And then I got one toe. Never forget the dew claw. And that's it. I'm going to place an emergency abdominal bandage on this dog just for video purposes. Obviously, she doesn't have any major issues, but we're going to see if she'll hold still for me at least. So I'm going to use some sterile 4x4s just in case she, if she were to have an injury to her abdomen, this is what I would probably use if it was, a cut or whatever. And then I've got my stretchy gauze, so I'll probably pack it up underneath here. This is in an emergency situation, so if we were trying to either transfer or get her in from, like if she was hit by a car or something, we're just trying to get her to the vet. all the way around with that. And then I've got my stretchy bandage, which kind of just helps hold things a little bit tighter because it's stretchier. So we'll get it just as tight as we can. And we'll set it. And that should hold. Okay, so now I'm going to apply a modified Robert Jones with a splint. It's pretty much the same as what I had done previously. We're just adding the splint instead. So I'm going to make my straps again, like I had explained in the other video. Again, these just help hold the bandage and the splint in place. It's a trick my preceptor showed me. So I have my cotton, which again I have an 8-inch roll of cotton, but his leg is so short I needed to cut it down so it would actually fit. And we need a decent amount of padding here because the splint can do damage if it rubs or anything like that. So again, he does not actually have an injured leg. It is just for demonstration for this video purposes only. So I have my gauze on and my stirrups on. So now I'm going to apply my stretchy bandage. Again, leaving his toes exposed to watch for swelling or that kind of a thing. And if I didn't say previously, he is under some light sedation. And if his break was in between anywhere, we want to immobilize the joint above and the joint below. And this is where I would place my splint. It looks like it doesn't fit because of the padding, but it is fitting on there. So then I will take my stirrups. And then I will take my vet wrap. Sure it's in the right spot here. so that is my modified Robert Jones with a splint. Now I'm going to remove my Robert Jones with the splint. So I'm going to start by taking my vet wrap off. And I have my bandage scissors again with the protective edge so I don't hurt him in any way. I'll actually probably come down the side here and cut all of this away. It takes a lot to get through all the padding. Alright, so now we'll carefully remove the splint. And then carefully finish peeling the tape from the stirrups. And that is our removal of a modified Robert Jones with a splint. Okay, so now I'm getting dental x-rays. You're on to the right side now. So I'm going to take my probe and I'm going to put it at the back of the mouth. Can you get a close-up, please? And position down here so we can make sure when we shoot we get the roots. So there's that. I'll position this like that, and then we'll shoot. So we'll come in here and we'll make sure we have it up on the screen, and then we've got our button here, and we'll see what comes up. So there's that view, and we had already done the other side. So we'll show one more view of me taking them on the bottom here in just a minute. Okay, so now I'm on the bottom teeth. I'm going to get some of my other premolars and my lower right canine. So I'm positioning my probe like so. And I have a paper towel in there just to kind of help hold it in place. And I'm going to position her just a little bit more the way I want. Alright, so let's go see what that gets us. So I have the correct spot that I want clicked here. As you can see, this was my previous one with my lower fourth and my first molar. I'll go ahead and fire. And then you can see my premolars and part of my canine, so I'll have to get another one that gets a better view of the canine root. But my exposure is also good. The computer helps kind of determine that. Go. Okay, so now I am going to clean this dog's teeth, and I'm going to crack some of the tartar off this big tooth. You want to come gently kind of scrape it off. And I'll also use my hand scaler to get some of the bigger chunks off as well. So, and then I will take, when I get some of those big chunks off, I will take my ultrasonic cleaner and I will clean up the teeth and get some of the smaller chunks off. I don't want to stay on each tooth for too long. I gotta keep moving.
I'm sorry, what was in the right here?
And I'm gonna go ahead and do that on all the rest of the teeth. And then I will have it come back when I am polishing. So, with dental care at home, typically certified veterinary dentists recommend brushing the teeth twice a day, just like you would yourself, to keep tartar and plaque kind of away. But that's not always possible it's not always possible. So there are things like Orvet chews and Tartar Shield chews that help scrape as much plaque and tartar off. Typically they recommend once a day. This is kind of a rougher texture, the Tartar Shield is, so it helps scrape it a little bit better. The Orvet it's kind of got a gummy center, and so when they chew on it, it helps pull it off, and they've proven that in a lot of different studies. So at our practice, we recommend these two just because they are certified by the Veterinary Dentist Association.